Hey guys, it's Carl Rothschild here. Hope you guys are doing great. Um, I just wanted to have a really conversation with you in regards to now you've had the bed for a little bit. I wanted to just get an idea of what your feedback would be in regards to that. So first of all, how long have you guys had the bed? Well, first of all, why don't you guys introduce yourselves?
Okay, hi, Tom Oliver, Dr. Oliver. I practice in Morristown, New Jersey, just outside of Philadelphia, and been practice here for a number of years. And this is Maureen Rooney, and we brought the Trifecta bed in I'd say about 6 weeks ago. We started. Yeah.
And so give me some feedback.
So a couple things. Well, we brought in. I brought a nurse practitioner in, actually, my daughter Alex. She started really she was the one who was really going to run the program and take over the program, and she's done a great job. We brought in initially for the red light program and for the weight loss, and we've seen very, very good results for that. We've seen as many as 9.5 inches just within a 10 to 12 minute treatment, for measuring before and after, which has been great. Typically we'll see around 4. Always say at least 2, but we get 2 without a problem. We're going to bring in another piece of equipment. It's supposed to actually be here as of yesterday, called Styku. So, and to kind of get the measurements a little more accurate and kind of speed things up. And but so far, really good from the weight loss end. That's been really good. We've had good success. Patients have liked it. From my end, being a chiropractor, we deal with a lot of chronic problems, and I specialize in neuropathy. So I've had a number of patients go back who are neuropathy patients and attempt to use the bed, and we've had good success with that, with treatment of acute and chronic pain so far. And I have one girl, she's 28 years old. She has 4 pedicle screws in her low back, L5, L4, has had excessive pain for 2 years. She came in acute pain. I treated her for a little while, and we put her back in the bed, 3 treatments in the bed, 3 days in a row, and she was significantly better. So much that she went and got a job back. So I have 2 other patients who have neuropathy. So one I just mentioned, who was the girl who was 28 with the pedicle screws. The other 2 patients I have, one is a patient who has Charcot-Marie tooth, CMT, who's had it for 15 years.
Was that Shelly, the video that you sent us? The guy's name
correct.
Is his name Shelly? Is that his name?
No, it's
Joey.
Joey. Okay. Joey. I thought I heard you say Shelly. Joey.
No, Joey. So anyway, he's had, he's been severe. You saw his gait when he first came in. It was horrifying. We've got his gait, looks great. And I've done a lot of work in neuropathy with him. And he responded really well. He was thrilled with the results he had over a period of 3 or 4 months. I suggested, actually, what really happened was, it kind of came backdoor, because he was talking to me about his wife. I was telling him I'm going to bring this red light treatment in, and it's really for weight loss. Initially, I was talking about with him, because he was talking about his wife wanted to lose weight. She went to a nutritionist, and she wasn't real happy. So I said, look, we're bringing this in. I said, I have a nurse practitioner running a program. Needless to say, they went back and they both signed up for the treatment. And I said to him, Joe, listen, with this near infrared, you may get some good results with your neuropathy as well. So he signed up for the weight loss, not really coming in for the near infrared. Well, long and short is, he has some dramatic changes. He's lost over 10 pounds just in the first 2 weeks. So he's happy with that. And by the end of the 3rd week, after 6 treatments of using the near infrared, he told me, this was last week I was talking to him, he said his pain went from like about a 5 or 6 down to 0. And he said for 5 days. He said he's never experienced that, never had no pain. And he said, so much so, he said, he was walking the dog, he said, literally no pain at all. I said, well, how did you feel, walking your dog before? He goes, I haven't been able to walk my dog for 15 years. So, yeah, so that's pretty remarkable to see the kind of dramatic change that just in 6 treatments. I had one other woman I have who I treated for neuropathy. She's done really well. She had a really hard time. Her gait was terrible. We've improved her gait dramatically. She's gotten much better. And I told her, I said, Sarah, why don't maybe you want to try this, near infrared. This may be, after I did a 3-month evaluator, I told her this may be an option you want to consider that may help to accelerate the progress. Because she still, after 3 months, she still had a ways to go, but doing remarkably better. She was able to walk over curbs. She couldn't even walk up her driveway before. Now she doesn't even think about her legs. So anyway, she said she's claustrophobic. She's about 80. She was reluctant a little bit. I took her back, I actually turned the bed on just so she could see what it would look like. So my daughter, Alex, again, the nurse practitioner, she helped her. She went through the whole, explained to her what the near infrared was, some of the trifecta information you had. And then she put her in, and after 4 minutes, Sarah said, you gotta get me out. So she wasn't comfortable because she was claustrophobic a little bit. So we got her out. I thought, well, maybe that's not really going to be for you, which is okay. We tried it, that was a week ago, Monday. The following day, she called Maureen and she said, listen, I know I had trouble with that being in there, but my feet had felt entirely different after I was done that treatment. That was 4 minutes. So that was pretty remarkable. So she came back in yesterday and she signed up for a treatment program for the near infrared portion. She's coming in for a couple months for that treatment. So
right. We just explained to her that, she didn't have to have the lid completely closed down over her. She has her feet in front of the box. And I said, however comfortable you feel, you have control over the lid. You pull it down where you feel comfortable.
Right.
And she did. She's, I'm good with this. And she still got the benefit.
Right.
And you had the foot panel on there for her, right? That's why you can't have her head outside of the bed, right?
Right.
And then so I wouldn't mind also you addressing, what do you guys think about that foot head panel? Does that make a big difference?
Oh, I love it.
I do too.
I mean, let me tell you, I'll tell you why I love it too. And this is just from a personal standpoint, okay, honestly. But from a cognitive standpoint, I can't believe the difference. Now, we've had this for 6 weeks. Mm-hmm. The first time I treated, this is just my own personal, testimony, I guess you'd say. But I treated for 1 day. And I honestly thought, I don't really feel any different, that day. I thought, okay, well, you know what, I mean, I'm a healthy guy, I work out, I'm in pretty good shape. So I thought, okay, the next day, I felt like I could sprint a mile. I thought, okay, maybe I'm just having a really good day, But now I've been doing this now for 6 weeks. And I have to tell you, I have not had this kind of consistent energy level and cognitive clarity. It must be a while because I don't remember having this for a period of time. So I actually turned the neuropathy piece on and I have my head up. So I'm really getting bathed, my whole body plus, my head, with the near infrared. So that's my own personal, testimony.
Yeah, and I have to say too, with people in New Jersey that all around, as on the East Coast, we suffer from seasonal affective disorder, clocks change. So every year, there's a little adjustment. You feel a little blue, but I'd say this year, we were doing the red light treatment prior to the clock changes, and then once the clock changed, I really didn't feel any different than before the time changed. Like I didn't feel like I needed to wake up for that sleep, or now it's darker now, I'm feeling a little sluggish. Just felt so much better just using that bed. I really think it's a tribute to that because I've never had that before. It always affected me every season change.
Yeah.
What would you say to somebody, the bed costs more than our other systems, it's a little bit more expensive. What would you say as far as this being a smart investment on your part?
Well, initially we looked at the pad system, and we honestly, this is our first time in, so I didn't really have a pad system to compare it to. I talked to people who had pad systems, and at first I looked to a few other systems, and then I involved with a consulting group, and she directed me really towards Trifecta because she really felt like in the pad system you had the best quality product. And that was her experience, and also several other successful weight loss offices. So that was my first direction towards you. And then when we talked about it, I called you and we spoke about it. The thing I think that attracted me was, one is if you have the pad system, I think just that direct contact and the fact you have to clean them and the amount of work you have to do in order to put a patient on, take a patient off, they're under there for 20 minutes, you know, that was a component. I was willing to do that if we went for the pad system. But when you look at the bed system and you look at the ease of getting it, first of all, it's almost not half the time, but it really is probably less than half the time, because if you think about it, you're going to be putting in, you're putting pads on the patient, you're taking the pads off the patient. The patient has them on for 20 minutes. In this situation, the patient's in there 10 or 12 minutes, but you're not, all you're doing is wiping down a bed. So it was easier, it was much easier to staff, it was much easier, I think, to close the door, patient gets changed on their own, it's much more private. And I thought from a cost effectiveness, you know, in terms of return on investment, it seemed as though most people I talked to said if you get one pad system, you're probably going to get the second one, which I think is, you know, from their experience, not my experience, that was what they were telling me. So I thought, well, if you're looking at two, then, you know, are we getting, you know, the same efficiency out of buying this? So that was kind of where my thinking was, really, you know, in evaluating return on investment. Really.
Plus you said too, that bed, 10 years, that bed is going to look exactly like it does the first day we got it.
That's a good point.
You know, so it's beautiful. It's a beautiful system. It's pristine, ease of use. And I can't imagine really not going with the bed.
Yeah.
Yeah, I'm glad we did.
Yeah.
All right, guys, this has been great. I know we're going to be in touch a lot in the future, but I just really want to thank you for this. And obviously, if you ever have any questions or anything, just give me a call. All right.
Sure.
Sounds good.
Thank you so much.
All right.
Thanks, Carl.
You're welcome.
Okay. Thank you.